Did you know that after the age of 60, a common fruit that you might consume daily without a second thought could potentially devastate your kidneys? This is a stark reality that many healthcare institutions might not openly disclose. Today, I intend to unveil the complete truth. My allegiance is not to hospitals or their systems, rather, it lies with you. My primary concern is to safeguard your invaluable kidneys and to prevent you from depleting your retirement savings on exorbitant medical expenses. A significant number of you likely believe that fruits are universally beneficial for health and incorporate them into your diet every single day. However, this perception undergoes a profound transformation after the age of 60. Fruits that once provided health advantages during your younger years can, as you age, become detrimental, akin to sharp blades piercing your kidneys. In severe instances, individuals might find themselves requiring dialysis in less than a year. Greetings to everyone. I am Dr. Rennie Bernard, a nephrology specialist with 35 years of dedicated experience. You might question why there's a lack of public awareness regarding these specific dangers. The unfortunate truth is that the prevailing medical paradigm is heavily oriented towards treatment rather than proactive prevention. But rest assured, by diligently viewing this video to its conclusion, you will gain comprehensive knowledge of the 4 specific fruits that must be absolutely avoided after the age of 60 due to their potential to harm your kidneys. Conversely, you will also discover the 4 miraculous fruits that possess the remarkable ability to revitalize even failing kidneys. The information presented here is of paramount importance and directly linked to your well-being and longevity. I strongly encourage you to subscribe and to like this video immediately. This content has the potential to safeguard your life and the lives of your loved ones. Before I reveal the first dangerous fruit that can imperil your kidneys, it is crucial to first understand the fundamental reasons behind the physiological changes your body undergoes. Post 60 years of age, your body experiences significant and often radical transformations. Specifically, the functional capacity of your kidneys declines by approximately 1% for each passing year, eventually regressing to about half of their youthful efficiency. Envision this as a vital filter that has been in continuous operation for 3 decades without any form of maintenance or replacement. The potassium and other toxins that your younger body could easily process and expel are now no longer efficiently filtered, leading to their accumulation within your system. In this compromised state, continuing to consume fruits with the same dietary habits as when you were younger can have severe repercussions. We have a real-life example in Mr. Pierre Dubois, a 67-year-old resident of Lyon, who was rushed to the emergency room after consistently consuming potassium-rich fruits, operating under the misconception that they were uniformly healthy. The diagnostic tests revealed alarming results. His potassium levels had reached critically high levels, placing immense strain on his heart and posing an immediate risk of cardiac arrest. This is not an isolated incident. It represents a scenario that could befall any one of us without prior warning. Yet, one must ponder why hospitals do not proactively warn individuals about such impending dangers. The unfortunate reality is that hospitals are primarily structured to treat individuals who are already ill, operating on a model that prioritizes intervention over prevention. My sincere aspiration, however, is for you to experience a long and healthy life, free from the necessity of hospital confinement. It is precisely for this reason that, even if it invites criticism, I am committed to divulging the unvarnished truth today. The 4 fruits I am about to discuss are those that you must absolutely refrain from consuming after the age of 60. It is imperative to first comprehend a truly terrifying fact. Our kidneys are remarkably silent organs. Unlike your liver or stomach, which can signal distress through pain when they encounter problems, your kidneys offer no such warning until their functional capacity has deteriorated by over 70%. This lack of immediate feedback makes their silent decline all the more alarming. Even as you sit here, believing yourself to be in good health and casually enjoying fruits without concern, your kidneys might be silently signaling for help, teetering on the brink of failure. This is particularly true after the age of 60, when the kidney's filtration efficiency plummets dramatically, rendering them incapable of eliminating excess potassium through urine. In your youth, potassium was a beneficial mineral, vital for muscle function. However, with aging and weakened kidneys, this same potassium can enter your bloodstream, travel to your heart, and transform into a potent and potentially fatal poison capable of inducing cardiac arrest. This condition is known as hyperkalemia, a truly grave ailment that can lead to sudden death from cardiac arrest without any discernible prior symptoms. To circumvent this perilous threat, the very first fruit you must strictly avoid after the age of 60 is the banana. This revelation may come as a significant surprise to many of you. Bananas are convenient, sweet, and widely considered a staple fruit. However, for individuals over 60, they can pose a danger comparable to a cyanide capsule. A single banana contains a substantial amount of potassium, approximately 420 milligrams. When consumed daily by individuals with already diminished kidney function, your kidneys are simply overwhelmed and unable to process this excessive potassium load, leading to their progressive deterioration. In fact, a study conducted in the United States indicated that among patients over 60 with reduced kidney function who consumed 2 bananas daily, the risk of experiencing a heart attack increased by a staggering 4-fold. These are profoundly shocking findings. Compounding this issue is the high sugar content of bananas. The sugar concentration in a single banana is so elevated that it is equivalent to about 4 teaspoons of sugar. After the age of 60, insulin resistance typically increases, making blood sugar regulation considerably more challenging. Consuming a banana, particularly on an empty stomach in the morning, can cause an instantaneous surge in blood glucose levels, exceeding 200 milligrams per deciliter and triggering a significant glycemic spike. This abrupt rise in blood sugar thickens the blood, which in turn can obstruct the microscopic blood vessels within the kidneys, effectively doubling the damage to these vital organs. Furthermore, bananas are relatively low in magnesium while being exceptionally rich in potassium, creating a mineral imbalance that can manifest as muscle cramps or chronic fatigue. If you have been incorporating bananas into your morning routine, with the belief that they were beneficial for your health, it is imperative that you cease this practice immediately, starting from today. If you currently have bananas in your refrigerator, resist the temptation to consider them a waste and dispose of them without delay. This decisive action is a crucial step in preserving the health of your kidneys. The second fruit that warrants absolute avoidance is the grape. Grapes are naturally sweet and easy to consume, making them a popular choice, especially for older individuals who often enjoy them after meals out of habit. However, when considering the health of your kidneys after the age of 60, grapes present a significant and potentially dangerous choice. The primary concern with grapes is their exceptionally high sugar content. A mere 100 grams of grapes contains no less than 16 grams of sugar, which is akin to consuming 4 pieces of candy in one sitting. Eating an entire bunch of grapes can easily surpass 3 times the recommended daily sugar intake. What makes grape sugar particularly problematic is its composition. It's a combined form of glucose and fructose. This dual sugar profile places an immense strain on the pancreas, which is already compromised with age. The pancreas is forced to secrete excessive amounts of insulin, eventually leading to its exhaustion and the development of diabetes. Scientific evidence supports this concern. A study by the French Diabetes Association revealed that individuals over 60 who frequently consumed grapes had a 2.8 times higher incidence of developing diabetes compared to the general population. Notably, larger grape varieties such as Muscat de Hamburg or Shine Muscat possess an even more concentrated sugar content, rendering them even more perilous. Another serious health risk associated with grapes is their oxalic acid content. The oxalic acid present in grapes can bind with calcium in the kidneys, leading to the formation of kidney stones. After 60, with reduced kidney function, even small quantities of oxalic acid that cannot be effectively eliminated can solidify into painful stones. The onset of kidney stones is characterized by excruciating pain, often described as a sharp, stabbing sensation in the flank, which can necessitate an emergency room visit and, in severe cases, surgical intervention. Furthermore, once kidney stones have formed, the recurrence rate is alarmingly high, at 80%. Beyond stone formation, grapes also contain compounds that can interfere with blood coagulation. In individuals over 60, who often experience compromised circulation, this can contribute to the formation of blood clots, significantly increasing the risk of stroke or heart attack. This risk is particularly elevated for those already taking medications for hypertension or blood thinners. Such individuals must absolutely refrain from consuming grapes, as they can lead to dangerous drug interactions and unexpected adverse effects. Dried grapes, such as raisins, are equally hazardous. The dehydration process concentrates the sugars, imposing an even greater burden on the kidneys than fresh grapes. Therefore, beginning today, it is essential to avoid all grape-related products to protect your kidneys and embark on the path to their preservation. The third fruit that should be strictly avoided is the mango. While often lauded for its rich nutritional profile, after the age of 60, the mango presents several significant health risks. The most pronounced issues with mangoes are their exceptionally high sugar and potassium content. A single mango can contain as much as 45 grams of sugar, exceeding the sugar content of a can of cola. For individuals over 60, who typically experience increased insulin resistance, consuming such a sugar-dense fruit can cause blood glucose levels to skyrocket to over 300 milligrams per deciliter. Mangoes possess a very high glycemic index, often reaching 80, which is even higher than 100 grams of white rice. This makes them particularly dangerous for individuals with diabetes or those undergoing treatment for related conditions. Furthermore, mangoes contain a toxic substance called urushiol. This compound is an allergen belonging to the same family as poison ivy. While it might not have caused issues during youth due to a robust immune system, a weakened immune system after 60 can trigger severe allergic reactions. Indeed, many individuals develop redness or rashes around their mouths after consuming mangoes, and in severe cases, this can lead to breathing difficulties, requiring emergency medical attention. Additionally, the vitamin K present in mangoes can interfere with the blood coagulation process. For individuals over 60 who are already on medications that affect blood circulation or are taking anticoagulants, this can diminish the effectiveness of their medication and prove dangerous. Moreover, mangoes are notoriously difficult to digest. With a naturally decreased digestive function after 60, consuming mangoes can lead to abdominal pain, diarrhea, and general digestive distress. Eating mangoes on an empty stomach can particularly stimulate gastric acid secretion, exacerbating existing stomach ailments. The high caloric content of mangoes also poses a problem. A single mango can contain nearly 200 calories, comparable to a bowl of rice. After 60, as metabolic rates tend to decrease, frequent consumption of such calorie-dense fruits can contribute to abdominal obesity and elevate the risk of chronic diseases. Do not allow the deceptively sweet taste of mangoes to compromise your health. For a healthy aging process, it is strongly advisable to completely abstain from mangoes. The fourth and final fruit that must be strictly avoided is the persimmon. Persimmons are a beloved autumnal fruit for many in France, but after the age of 60, they become a particularly hazardous choice for both kidney and stomach health. The primary concern with persimmons is their tannin content, which imparts their characteristic astringent flavor. The tannins in persimmons can lead to the formation of gastric bezoars in individuals over 60 whose gastric acid secretion has diminished. A gastric bezoar is essentially a solidified mass of undigested food that accumulates in the stomach, forming a stone-like concretion. The development of a gastric bezoar can result in severe abdominal pain, vomiting, and significant digestive disturbances. Each meal might be accompanied by a sharp pain in the stomach area and a persistent feeling of indigestion. In extreme cases, this can even lead to intestinal obstruction, necessitating emergency surgery. Research from a French university hospital indicates that a significant proportion of patients over 60 who suffer from gastric bezoars regularly consumed persimmons. The risk of bezoar formation is further exacerbated if persimmons are eaten on an empty stomach or concurrently with protein-rich foods. Another issue with persimmons is their substantial sugar content. A single sweet persimmon can contain approximately 25 grams of sugar, which can cause a rapid spike in blood glucose. Dried persimmons are even more problematic. The evaporation of moisture concentrates both the sugar and tannin content, making them considerably more harmful than their fresh counterparts. The sugar in a dried persimmon is equivalent to 2 fresh persimmons, and the tannin concentration can be up to 3 times higher. Additionally, persimmons contain an excess of beta-carotene. While a moderate intake is beneficial, excessive consumption can lead to carotenemia, a condition that causes the skin to turn yellowish. After 60, with a compromised liver function, the body's ability to metabolize beta-carotene is impaired, making this condition more likely to occur. Persimmons can also contribute to constipation. Certain components within the fruit can inhibit intestinal movement, thus worsening constipation. For individuals over 60 whose bowel movements are already slowed, this can lead to severe and debilitating constipation. Furthermore, it is crucial to note an important interaction when consuming persimmons. Eating them with protein-rich foods, such as crab, poses a risk of food poisoning. The tannins in persimmons can bind with proteins, forming indigestible toxic substances. Many people believe that ripe or overripe persimmons are less problematic, but the tannin and sugar content remain, posing the same risks. You may consider them an autumnal delicacy, but for the sake of your health, it is essential to courageously forego them. Up to this point, I have detailed the 4 perilous fruits that should be entirely avoided after the age of 60: bananas, grapes, mangoes, and persimmons. These fruits, due to their high sugar, potassium, oxalic acid, and tannin content, can trigger detrimental effects such as blood sugar spikes, cardiac arrhythmias, kidney stones, and gastric bezoars. If these fruits are currently in your refrigerator, cease their consumption immediately. However, please do not succumb to excessive worry. Just as there are fruits to avoid, there are undoubtedly miraculous fruits that can actively protect and revitalize your kidneys. In the forthcoming segment, I will introduce you to 4 precious fruits, akin to nature's jewels, that hold the potential to even resurrect failing kidneys. After hearing about the dangerous fruits I've just described, your heart might have sunk with the thought, is it already too late for my kidneys? But please, do not despair. Our bodies possess a remarkable capacity for recovery, far greater than we often realize. The fundamental culprit behind kidney deterioration isn't merely the passage of time, it is largely due to the accumulation of a toxic substance known as free radicals within our systems. Much like a machine that corrodes and falters over time, our body's cells also suffer from oxidative damage caused by free radicals, which are unavoidable byproducts of our very respiration. The kidneys, acting as the body's primary filtration system, are particularly vulnerable to free radical attack, as they constantly process toxins from across the entire organism. When the glomeruli, intricate networks of microscopic blood vessels within the kidneys, become inflamed and hardened by free radicals, the only remaining recourse is often dialysis. So, is there truly no way to combat this oxidative rust and restore suppleness to hardened kidneys, enabling them to function optimally once more? Fortunately, nature itself has provided us with an antidote: fruits brimming with potent antioxidant compounds. Recent scientific investigations in the medical field have revealed that certain naturally occurring antioxidants possess an astonishing ability to dissolve debris clinging to blood vessel walls and to regenerate damaged kidney cells. This is not a matter of magic. It is a well-established scientific fact. The 4 fruits I am about to present are not mere snacks. They are natural remedies that can effectively cleanse your rusted kidneys and reignite their faltering function. Are you ready to take notes? I will now unveil the first miraculous fruit that offers salvation even to kidneys on the verge of failure. The first miraculous fruit that can revitalize your kidneys is the blueberry. Reverently referred to as nature's purple gift from God, blueberries stand as the premier choice for kidney health after the age of 60. The primary reason for their profound benefit to the kidneys lies in a powerful antioxidant compound called anthocyanin. As previously mentioned, free radical-induced inflammation is the leading cause of kidney deterioration. Anthocyanins act like a highly efficient vacuum cleaner, actively seeking out and eliminating free radicals from the body. This process is akin to meticulously cleaning the rusted glomeruli within your kidneys. Indeed, a study conducted at Harvard Medical School demonstrated that individuals who regularly consumed blueberries experienced a significantly slower rate of kidney function decline. Furthermore, blueberries are remarkably low in sugar. 100 grams of blueberries contain only about 10 grams of sugar, resulting in a negligible impact on blood glucose levels. Given that diabetes is a primary driver of kidney damage, blueberries offer a dual benefit, protecting against both diabetes and preserving kidney health. Even more significantly, blueberries have a remarkable effect on vasodilation, helping to lower blood pressure. Since the kidneys are rich in blood vessels, elevated blood pressure can lead to their rupture or damage. Blueberries, however, gently relax these vessels, thereby reducing the strain on the kidneys. The recommended daily intake is approximately 50 fresh blueberries, which is roughly equivalent to 1 small paper cup. If cost is a consideration, frozen blueberries are an excellent alternative. Their nutritional value is nearly identical to fresh berries, and they are significantly more affordable. Simply incorporating them into yogurt or enjoying them as a convenient snack will contribute to gradually cleaner kidneys each day. The second miraculous fruit I wholeheartedly recommend is the apple. The age-old adage, "an apple a day keeps the doctor away," proves remarkably relevant to kidney health as well. The specific component in apples that makes them particularly beneficial for the kidneys is pectin, a type of soluble fiber. Pectin plays a crucial role in absorbing excess cholesterol and toxins circulating in the bloodstream, effectively aiding in their elimination from the body. In essence, apples assist in performing the filtration tasks that the kidneys are responsible for. When the kidneys are overburdened and struggling to function optimally, apples step in to alleviate their load, providing them with a much-needed opportunity to rest and recover. Moreover, apples are abundant in quercetin, an anti-inflammatory compound. This remarkable compound helps to soothe inflammation within kidney cells and prevents the hardening of kidney tissues. Apples also boast a low glycemic index, meaning they are digested and absorbed slowly, thus avoiding any sudden spikes in blood sugar. However, there is a critically important point to note here. The majority of an apple's nutrients are concentrated in its skin. Discarding the peel and consuming only the white flesh is akin to throwing away half of its nutritional value. It is essential to wash apples thoroughly and consume them with their skin intact to fully harness their kidney-saving benefits. Consuming half to 1 apple, slowly chewed, after breakfast is an excellent practice. However, I strongly advise against juicing apples or blending them into smoothies. The juicing process destroys the beneficial fiber and concentrates the sugars, which can paradoxically elevate blood sugar and place an undue burden on the liver. It is only when an apple is properly chewed that it transforms into a genuine kidney-saving medicine. The third fruit that you absolutely must incorporate into your diet is the avocado. Many individuals tend to avoid avocados, perhaps due to their perceived fat content or the misconception that they are not truly fruits. However, for individuals over the age of 60, there are few better fruits for promoting the health of your blood vessels and consequently, your kidneys. The core benefit of avocados lies in their rich content of healthy monounsaturated fats, which are instrumental in cleansing blood vessels. The kidneys are among the organs with the densest concentration of blood vessels in the human body, and for them to remain healthy, these vessels must be kept clear. The beneficial fats in avocados help to dissolve the unhealthy fats that accumulate on the walls of blood vessels, thereby purifying the blood. As the blood becomes cleaner, blood flow to the kidneys improves, allowing them to function more efficiently. Furthermore, avocados contain a remarkably low amount of sugar, with less than 1 gram per 100 grams. This makes them one of the few fruits that individuals with diabetes can safely consume. Avocados do contain potassium, but in moderate consumption, this potassium actually aids in blood pressure regulation by helping to excrete sodium. However, if you have been diagnosed with advanced kidney disease and are under strict potassium restrictions, it is always advisable to consult with your physician before incorporating avocados into your diet. For those focused on preventing the general decline of kidney function and safeguarding cardiovascular health, consuming approximately half an avocado daily is more beneficial than many supplements. Whether mashed into rice or added to a salad, you can literally feel your blood vessels rejuvenating with each delicious bite. The fourth and final miraculous fruit that can revive your kidneys is the tomato. There is an old Western saying that when tomatoes are red, doctors turn pale, underscoring their profound health benefits. Tomatoes are a near-perfect health food. When it comes to kidney health, the tomato's ultimate weapon is a compound called lycopene. Lycopene is one of the most potent antioxidants known, possessing an exceptional ability to combat cellular aging in the kidneys and repair damage caused by toxins. This is particularly crucial after the age of 60, as blood vessel elasticity naturally decreases, making hypertension a more prevalent issue. Since hypertension is a leading cause of kidney destruction, the lycopene in tomatoes helps to strengthen and enhance the elasticity of blood vessels, stabilize blood pressure, and improve blood flow to the kidneys. Scientific research has indeed shown that individuals who regularly consumed tomatoes experienced a significantly lower risk of kidney function decline compared to those who did not. Tomatoes are also rich in water content, which aids in flushing out waste products and promotes more frequent urination. For optimal consumption of tomatoes, it is vastly more beneficial to eat them lightly cooked rather than raw. When heat is applied, the absorption rate of lycopene into the body increases by more than 5-fold. Lightly sautéing them with a touch of olive oil or briefly blanching them in boiling water will ensure you fully benefit from this kidney-saving compound. Consuming 2 medium-sized tomatoes, or about 10 cherry tomatoes per day, is generally sufficient. It is absolutely forbidden to add sugar to tomatoes. Sugar not only destroys the vitamin B content in tomatoes, but also causes blood sugar to rise, negating all the beneficial effects. Savor the natural sweetness of the tomato itself. To summarize, the 4 miraculous fruits that can revive even failing kidneys are blueberries, apples, avocados, and tomatoes. The common thread among these fruits is their low sugar content, their abundance of antioxidant compounds, and their ability to cleanse blood vessels. Instead of seeking expensive supplements or unverified folk remedies, these readily available fruits represent the most effective kidney treatments nature has provided. Starting today, replace your usual snacks of bread or rice cakes with these nourishing fruits. Even after just 1 week, you should notice a lighter feeling upon waking and a clearer color in your urine. However, even the most beneficial foods can become harmful if consumed improperly. This is especially true if you are already taking medication for kidney disease. There are specific precautions you must adhere to. In the subsequent section, I will share the remarkable journeys of individuals who have successfully restored their kidney health through these fruits, along with essential consumption guidelines that you absolutely must not overlook. Without this knowledge, even consuming beneficial fruits might yield no positive results, so please pay close attention until the end. Even after hearing these accounts, some of you might harbor doubts, thinking, can my kidneys truly improve simply by changing a few fruits? However, this is not mere theory. It is a testament to the numerous miracles I have witnessed firsthand in my practice. Let me recount the story of Mrs. Sophie Martin, a 70-year-old resident of Marseille. Last year, Mrs. Martin was diagnosed with stage 3 chronic kidney disease during a routine health examination, plunging her into despair. Every morning, her face, hands, and feet were severely swollen, and her urine was foamy. Her doctor warned her that if her condition worsened, she would likely require dialysis. She had dedicated her entire life to her family, yet she spent her nights weeping, consumed by the fear of becoming a burden to her children in her old age. Clinging to any sliver of hope, Mrs. Martin resolved to make a radical shift in her dietary habits. She immediately discarded all the grapes and kaki juice from her refrigerator and began incorporating blueberries and tomatoes into her daily morning routine. And what was the outcome? Exactly 3 months later, upon her return to the hospital for a follow-up, her treating physician was astonished by the test results. Her creatinine levels, which had been dangerously high, had dropped to near normal ranges, and protein in her